On the Medical Watch today, delving more deeply into the surgery Pope Francis underwent this morning. Doctors in Rome put the 86-year-old pontiff under general anesthesia to repair a hernia. This operation follows a partial colon removal 2 years ago. There were no complications in the 3-hour surgery, and his physicians say he is awake now and in recovery. So, here to talk a little more about the type of operation, why it's necessary, the risks, the recovery, Dr. Robert Shimke, who is the general surgeon at Rush University Medical Center. Thank you for coming in. We appreciate it.
Thank you for having me.
So tell us a little bit about a hernia and how dangerous it can be if left untreated.
Sure. There's a strength layer of your abdominal wall called fascia, and it is weakened after any type of surgery, and you can develop essentially a hole, which is what the hernia is. And the hernias can come in all different shapes and sizes and locations depending on the previous surgery. And through that hole, you can have a protrusion or a hernia of colon, intestines, fat, whatever may be protruding through that hole. And so depending on the size, the shape, and what is herniating through that defect will determine kind of the urgency and how quickly it needs to be repaired and kind of the severity of it to that person.
Right, because if the colon is kind of pushing in there and blood is getting cut off to it, that could potentially be dangerous.
Right, it can
and
cause
painful.
Yeah, it can be definitely painful. It can cause an obstruction where things physically can't get through the colon, or if the blood flow is cut off, that becomes an emergency where the bowel is compromised.
One of the things that his surgeon said is they did an open surgery. So many of us who've undergone, say, hernia operations or others have gotten used to these minimally invasive and laparoscopic procedures. So why the need to go in and do an open surgery?
So in full disclosure, I am a minimally invasive surgeon, and so I do these operations both open but also robotic and laparoscopic. And so it just depends on the patient. It depends on the characteristic of the hernia, where it is, how big it is, the previous surgeries. There's a lot of different factors that go into it that determine what's the most effective and safe operation for this patient. Obviously, I'm not the Pope's physician, and they determine that this is the best, safest option for him. And we still do plenty of open operations on patients regularly. It just depends on, again, those specific characteristics.
And in this surgery, they said they had to put him under general anesthesia. The Pope himself had mentioned that he had a very difficult time in recovery. He felt from the anesthesia from his colon operation prior to this. What are some of the dangers, especially for someone who's 86 years old?
Yeah, I mean, age is just a surrogate, right? And so everyone has a different kind of medical reserve when they undergo anesthesia. And so it's just an overall stressor on the body, and it's an overall stressor on the heart and the lungs and kind of all the organ systems. And so it is something that we do routinely, even on patients that age, and patients do remarkably well. But it is something to always make sure we take all the necessary precautions and make sure that a patient is optimized before they have surgery with their fluid status, and make sure that their heart is in a good spot and all those things, so that they have the optimal outcome and they don't have any complications specifically from the anesthesia.
Let's talk about those outcomes and potential complications as we look ahead to recovery.
Yeah, with an open hernia surgery, they come in a lot of different shapes and sizes, and I don't know exactly what type of operation he had. But typically patients are in the hospital for a couple days, usually for pain control, just to make sure that their pain control is adequate. If there was intestines involved in the hernia, we want to make sure that the bowel function has returned and that they're eating and drinking appropriately. At that point, then the patient can go home, and then usually, you're going to have some pain, some soreness, but you're able to do your everyday activities of daily living. But you won't be back to kind of full strength, usually for about a month or so. We tell patients, no strenuous exercise, no heavy lifting for about a month, just until everything heals up.
Okay, so if we don't see the Pope out greeting people, we'll know why, and we shouldn't worry for at least a month. Thank you so much. This is truly helpful. I appreciate it, Doctor.
Of course.
Ray?
All right.